Hi everyone, I want to talk about stress incontinence. Stress incontinence. Okay, let's go. Stress incontinence is the common cause of urinary incontinence in women. In that case, there will be small amount of urine that will be lost, and that is mostly due to increased intra-abdominal pressure. Urethral hypermobility occurs when the supporting pelvic floor muscles relax or they are damaged. The pressure effect from the bladder on the urethra can cause the leakage. Okay, I will go over a lot of possible risk factors of stress incontinence. The first among which will be multiple pregnancy. And let me break that down that it's not everyone with multiple pregnancy that will come down with stress incontinence. So all women should not be scared. But to those who have pregnancy many times and carry the pregnancy to term and have delivery, and not all of you will come down with problem as well, but some will have cesarean section, and that is not counting when it comes to trouble with stress incontinence. Those who could feel concern are the individuals with multiple vaginal births, so they should check it out. Also, another possible factor is constipation, obstructive uropathy, chronic cough, heavy lifting, and obesity. Also, ascites, peritoneal dialysis, rigorous exertion, laughing, jumping, running, and menopause. There is possibility of intrinsic sphincter deficiency, which can be secondary to either pelvic surgery or irradiation, neurological disorders. And smoking is a culprit as well. What is the impact of stress incontinence or incontinence in general? There will be decreased physical activity, particularly stress incontinence, because when you exert yourself, the urine will drop. And there's likely going to be loss of self-esteem because you might be embarrassed with the odor and the need to clean yourself all the time. There's likely going to be anxiety and also depression. Anxiety because when you go out, you're anxious about what you might be faced with. And depression for the same reason because self-esteem is lost. And there's possibility of increased weight or marked weight loss. Increased weight because the individual is depressed and no longer active, or marked loss because there's decreased food intake as a result of depression or sadness or loss of self-esteem. And even without being told to be isolated, the affected people seem to isolate themselves from the society. And there is likelihood of public embarrassment and avoiding intimacy with people. What are the possible investigations? You can have what we call cough test, urinalysis, and renal function tests with blood, urine nitrogen, creatinine, glucose, and electrolytes. You can have urine microscopy culture and sensitivity test to rule out urinary tract infection. The treatment here will involve pelvic floor exercise called Kegel or bladder training. That is, you time yourself as per avoiding electrical stimulation, vaginal pessary if vaginal prolapse, and you can give medication like duloxetine, that is in bottle, and of course surgery if the bladder neck sling is going to be fixed, that is in case of intrinsic sphincter deficiency. And you can have what we call mid-urethral slings surgically if there's urethral hypermobility. Still on treatment, it will be wise to treat modifiable risk factors that you can handle. Now, and topmost here will be you adjust medications as it may be tolerable or appropriate. For example, diuretics, sedatives, and alcohol. If the individual is smoking, this is the appropriate time to discuss smoking cessation. And if there is associated lower urinary tract infection, the individual is ripe to be treated. And in case of constipation, you can use laxatives. You can have caffeine intake. If that is the issue, then stop or at least at the barest minimum. Excessive fluid intake should be decreased, particularly when you are going out. Vaginal bed can be changed to elective cesarean section. Still treatment continue as per marine vaginal cream, 2 grams per vagina once daily for 3 weeks. And you're going to take that off for 1 week. So get it right. 4 weeks of treatment with marine vaginal cream. If you get 2 grams per vagina, that should be taken once daily for 3 weeks. Then nothing will be taken for 1 week. So 3 weeks on, 1 week off. And symbiotic to that is duloxetine 30 milligrams once daily. But watch out for the side effects. Urethral dysfunction in men, hepatotoxicity in everyone, self-harm in everyone because it is an antidepressant. And with that, I end this very presentation for now. I'm going to talk about urge incontinence in the next presentation. Kindly subscribe to my channel so that you can get these presentations immediately they're published. Thank you.